Hello, today is April 22nd, 2012. I'm Rudy Ortiz, and I'm in the Senior Physiology Lounge at the San Diego Convention Center during the 125th anniversary celebration of the American Physiological Society. And today I have the pleasure and honor of interviewing Dr. Oscar Candia for the Society's Living History Project. Dr. Candia is a long-standing member of APS and has been affiliated with Mount Sinai School of Medicine, New York, since 1968. Dr. Candia's research focuses primarily on the mechanisms regulating ion fluid transport, membrane permeability, and related physiological parameters relevant to the epithelia of the eye. Dr. Candia, welcome to the Living History Project, and thank you for agreeing to be interviewed for this series. We greatly appreciate you taking some time to answer a few questions about your career and gain some insight on your perspective about today's science environment. Are you ready to get started?
Yes, I guess I am. I'd like to thank the Society for arranging this interview, and I'd like to thank you personally for taking the time to come to this room for the interview. And this is I have to say, a bittersweet occasion for me, mostly sweet, to be recognized and to look at my accomplishments of the past, but also understanding as a senior physiologist, the end of my career, I can see the light at the end of the tunnel. And I hope to continue doing research as long as my health allows, and as long as the National Eye Institute have confidence in me by supporting me as it has done for over 40 years.
Well, it certainly is our honor, and thank you again for your time. So let's get started. First off, can you tell us about your family upbringing and how you became interested in science?
My parents were teachers in a small city in a province northeast of Argentina called Corrientes. They live in a town, Cruzucuatiá. So they were teachers, and my father was the principal of an elementary school. My mother lost 2 babies, and they blamed the local doctor for that, I suppose. So when she got pregnant with me, she went to Buenos Aires, and I was born with no problem in a public hospital. And then I came back to that city immediately, 2 or 3 weeks later. And so I can say that I actually born and raised on that little town in Argentina. But this also have a biological significance. The only reason and I'm alive now is because I am Rh negative, and so was my mother. And at that time, they didn't know that. So that was the first obstacle that I had to go over to continue. Anyway, I went to elementary school then, at the school where my father and my mother were teachers. And then after that, in Argentina, I think still, I'm not so sure, high school and college are blended into one unit. So I went to the high school college, I think I was about 13 or 14, and graduated there. My father was also a history professor in that college. At that time, I didn't really have any thought about science or what I was going to do with my life. I like sport. I used to play soccer, tennis, basketball. But I was interested in understanding how things work. Mechanical things, for example. I used to take apart my father's Royal typewriter to see if I can put it back together. There was no TV or much to do in the afternoons. There was a car repair shop about half a block from my house. So I used to go there I learned how to take carburetors apart, put them back together, even engines, manual transmissions, etc. And I was very interested in that, and that became my hobby. That I had it a few years ago, and I could sort of fix, on diagnose at least, any car up to model 1972. After that, things got too complicated, too computerized. And then, when in high school, I think my parents start to tell me, what are you going to do with your life? And I say, I'm interested in math, I'm interested in physics, but there were not very prominent professions in Argentina. The profession that will open the doors to many opportunities was to be a doctor, even though you didn't want to practice medicine. With that idea, I went to Buenos Aires. My parents, middle class with relative small income, were able to find a place for me in a hotel, in a room where the worker used to live, one of those rooms. So I didn't stay in the regular hotel room, but I stayed in one of those rooms, and I helped the hotel by staying overnight at the clerk desk to check in people while I was studying medicine. So that's the beginning of my upbringing. I don't know if that's enough to tell you up to my idea when I went to Buenos Aires. So I went to medical school to have a title that could open the doors to many opportunities.
Great. Can you tell us about how some of your more memorable experiences during your academic training as an undergraduate or graduate student, a postdoc, molded your current position?
Okay, when I went to Buenos Aires, that was a total new experience for me. In first year of medical school, somehow because I was different, I was attracted to a small group of people from Buenos Aires, and they took me under their wings and took care of me. They invited me to their houses. We studied together. One of them was the son of the Secretary of Agriculture, a very prominent person at that time. And so they protected me. And at the same time, in the medical school, there was a separation of the physiology department and the biophysics department. So that was the second year in medical school, and when I gave the final exam of biophysics, the chair of the department was impressed with my physical knowledge, because I always liked physics and mathematics. And I don't know whether I applied or he offered me the job, but I became assistant in the Department of Biophysics while I was continuing my career in the medical school. So one person who influenced my career was the chairman of the department, El Dr. Sicardo. I can continue that after graduation, then I applied to be head of laboratory in that department. So I will teach the medical students biophysics, and at the same time, right after I graduated, I got married, and I got a job as a medical doctor in a hospital. It was very difficult at that time to support a family only being a head of laboratory of the School of Medicine. So I did both simultaneously, but my intention was always be an academician and probably doing research and teaching in physiology or biophysics. When Dr. Sicardo retired, there was a new head of the department, Dr. Strachman, who came back to Argentina after spending a few years in Berkeley in the RATS lab, I think it was called, where Oppenheimer was there. It has to do with the development of the atomic bomb, etc. And I remember Dr. Strassman used to tell us how life in the United States was different. That here people have big freezers and will go to a supermarket only once a week and could select whatever they want. So that gave me a sense of how different life in the United States was from what life was in Argentina, even in Buenos Aires, because after graduating I got married, I stayed in Buenos Aires. And at that time, another person very influential in my career was Jose Sadunaiski. Jose Sadunaiski came back from postdoctoral with Conway in England and with Usin in Denmark. Usin was the one who developed the short-circuiting technique to study ion transport in epithelia. And when Sadunaiski came back to Buenos Aires, he went as the director of research of the Department of Biophysics. And together we started studying transport in the isolated frog skin. That was the model used at that time. And for whatever reason, the isolated skin of the South American frog transported chloride stereosodium. And we published that, and that was a novelty. So the paper got accepted in Nature. And Sadunaiski went to an international meeting here in the United States from Argentina. And we even got a grant for NIH at that time to continue this work with the isolated frog skin of the South American frog. And when attending that meeting, he was introduced by another physiologist who was member of the American Physiological Society, William Brodsky, that told Sadunaiski that the chairman of ophthalmology in Louisville, Kentucky, was trying to create an eye institute. And he was looking for people who will come to do research in the eye. And when Sadunaiski went back to Argentina, he said, would you like to go to Louisville, Kentucky to start, but we don't know anything about the eye. Well, we just have to learn about the eye. And we have to get visas, no problem. The head of the Department of Ophthalmology is a doctor of a senator from Kentucky. And he's going to write a letter to the consulate in Argentina. And sure enough, we went to the consulate, U.S. consulate in Buenos Aires, and we didn't come with exchange visa. We came as a permanent resident in 1964. The only thing that I have to say in my declaration, I was not going to do drugs, and my wife has to say that she was not going to be a prostitute. Other than that, so we arrived in Louisville, Kentucky, and by coincidence, the chair of ophthalmology was also trying to give prestige to that eye institute and invited Hugh Dobson to come to Louisville, Kentucky. So when we arrived to Louisville, Kentucky, Hugh Dobson was there correcting his books. Actually, this morning there was a Hugh Dobson lecture in honor to these physiologists, but they forgot to mention that he was an eye physiologist and has written many books on eye physiology. With him, there was a postdoctoral student from Colombia who have applied to go to England as his postdoctoral. And then when Dabso came to Kentucky, Laszlo Vito, instead of going to England, he came to Louisville, Kentucky with him. Dabson at that time was only correcting his book in the morning and having beer in the afternoon. So Laszlo Vito was the head of the operation. And it's interesting because at that time, he was interested in prostaglandins to reduce the pressure in the eye as a treatment for glaucoma. Nobody believed him about that. And he used to tell me, listen, prostaglandin is not only produced by the prostate, it's also a lot of prostaglandin in the vagina. And he will present his work on prostaglandins, and that was very controversial. He came back to New York, to Columbia, and the situation, the chairman that hired me to go to Louisville, Kentucky, retired, and the new chairman was not really interested in the type of research that we're doing. So William Brodsky, the one who contacted Sadunaski Origina, that was in Louisville, Kentucky, decided that he wanted to go to the new School of Medicine being created in New York, Mount Sinai School of Medicine. And he told me that if I wanted to go also, that he will contact the chairman of ophthalmology at that time, and I say yes. Mount Sinai was a new medical school, and the chairman of ophthalmology was Dr. Earl Leopold, a man with great knowledge and instinct. But before I moved to New York, I had to remember to tell you that during my years in Louisville, Kentucky, I also met the chair of physiology, Warren Rim, an extraordinarily intelligent person that will question everything. And we have long conversations about how things work and why we believe this certain thing that has not really proven completely to be correct.
And what year did you get to Louisville, Kentucky?
1964. I graduated at the end of 59, and I got early 1964. And to go to Louisville, Kentucky was good for many reasons. I could read English, but I could not speak very well. At that time, we had two small children, and when I go into a place to get milk, I say, I need milk. And they didn't understand what I wanted. And I have a boy that was about 2 years old and a girl that was about 6 months. And I remember people in Louisville were very nice and naive. And when we were at the supermarket or department store, we'll speak in Spanish with the children, and people will be so little, and they already speak Spanish. Anyway, in 1968, I moved to Mount Sinai, and I have an interview. Well, first I have an interview with Dr. Earl Leopold. The interview lasted about 10 minutes, and he told me, "You're hired." And I think I have only 3 or 4 publications. And at what level? I say, well, we'll try for associate professor. That was exaggerated, maybe a 6. Well, I really didn't know at that time what curriculum you have to be at those levels. And there was some resistance from the dean office to I don't know if they were committees or what at that time, Mount Sinai, to be an associate professor, but Leopold said, no, I offered associate professor, that's what I wanted. Leopold was very influential. So that was another person who was important in my development, scientific career. And then Leopold, I think, wanted to be president of Mount Sinai. In the meantime, when that was going to be resolved, he took a sabbatical and came to California. And when he didn't get the job of president of Mount Sinai, he didn't return to Mount Sinai. And a new chair was appointed, Stephen Podos, a glaucoma specialist. I think that was about 1975. And he had a large influence on my career. He was a very good clinician, very good surgeon, but he was very interested in research. And of course, he was president of the most prestigious association for eye research, the Association for Vision and Research in Ophthalmology. He retired about 4 or 5 years ago. So I think I have mentioned the people who influenced my career, and but it all happened sort of spontaneously. I didn't plan. It just happens.
So you mentioned moving to Louisville in 1964, and the political climate, especially in the southern states and in the U.S. at that time, was difficult for anybody. And then coming from South America, not being familiar with the customs, the language, and everything, that must have been very difficult, very challenging, not just for you, but your family. What lessons did you learn from that transition, moving to a different country, especially to an area that was not politically secure? There's a lot of unrest.
Louisville was right at the border of that separation. And I think one important thing in moving from Argentina to United States, because I know for a fact that that happened to the family, the spouse. If it's not a scientist, has to support you. I know many families that came to United States. The spouse, be a man or a woman, didn't adapt. And finally, they went back to Argentina because they want to be with the relative, That doesn't happen to me. My wife adapted perfectly, and we decided that that was the best thing for us. And at the same time, I have ideas of, particularly when the situation in Louisville started to decline, to go back to Argentina. And I have some preliminary offers to get appointment in the university and go back. But when I answered the letter, the next letter was from a different person, because in Argentina, even now, the university is very political. The government changes, the situation inside the university changes, and it's very difficult to maintain a firm position in Argentina. At that point, I decided that going back to Argentina was not a good idea, and since I already have the permanent residency, we stay and move to New York. As I mentioned before, I was a good tennis player, and I met people who play tennis at the two extremes of the social situation in Louisville, Kentucky. On a certain day of the week, I will go and play tennis with people who have private courts in their houses. One of them was the head of the newspaper in Louisville, Kentucky that was a liberal paper. And the other one was a lawyer that represented the unions in Louisville, Kentucky. But in the other extreme, I became member of the all-black tennis club. And I used to play tennis with them and go to Indianapolis to play tennis against the other black tennis players. And then certain other days I will go to my friends with private course to play tennis. So I was lucky. I never felt that I was looked down, neither by the black people or by the white people. And I still have friends in Louisville, Kentucky.
So the APS has been very involved in engaging students, especially from South America, and bringing them and getting them involved with APS. What advice would you give to students from South America that want to come and study here and take a similar course that you have? What lessons have you learned in the progression of your career can you share with those students that want to take a similar career path?
The situation have changed dramatically. I don't think anybody can come straight with a permanent resident. You have to have a visa, and the visa is limited. And also, I know people who came to United States and then wanted to stay here, but the conditions of the fellowship that they got require that they go back to Argentina. So I don't know what type of advice will be appropriate at this time that the political and security situation in the world has changed so dramatically. I still know that many people come with I don't know what type of visa, and eventually they stay here or return to their country. But they have to examine the family situation, the opportunities here. The opportunities in Argentina have improved. There is more research, not of the amount that exists in here, but it's not so easy to progress in a research career in Argentina right now. So whatever advice I can give is to look at the situation carefully and make a decision the best you can.
So you mentioned early on that your first significant research experience was with the frog epithelium.
Right.
And then it kind of transformed looking at the epithelium in the eye. Was epithelial physiology your first goal, or what was your first ambition or desire in research?
I was, even when I came to the eye department and I learned about the epithelia and the tissue of the eye, the obvious thing was to study the cornea, that it was easy to dissect. And then I also I started studying with what is called the conjunctiva, what is the membrane that covers the white part of your eye and the inside of your lids. That also happens to have chloride transport. Inside your eye, there is the lens, that is the organ that focuses the light into the retina, and that have also transport mechanism. So also I studied a little more complicated the epithelia of the ciliary body. The ciliary epithelium is the tissue, is the epithelia that pumps fluid into the posterior chamber and then the anterior chamber of the eye to exchange nutrients, etc., and to keep the pressure of the eye. Let me make sure that I don't... my idea in general was to challenge, and I mentioned before, like Dr. Rin used to do, all theories that I was not convinced that they were correct. The driving force for fluid secretion for the aqueous humor in man is a chloride transport pump that is in the ciliary epithelium. We know that because chloride concentration in the aqueous humor is larger than in the plasma. So it's got to be some sort of transport mechanism. However, the typical model for eye research was the rabbit. For everything, for whatever reason, it becomes the model eye for eye research. But I find out that the rabbit ciliary epithelium transported sodium, not chloride. So I start looking for other tissues that, or other animal which eye will transport chloride. And the first one was, I remember a presentation in a meeting by a guy from Hong Kong that shows that the ciliary epithelium of the cow transported chloride. So I visited him and we published certain papers in showing that the ciliary epithelium of the cow transported chloride, just like man. So we figured that maybe cow will be a better model than the rabbit as a model for human. And when I told that to my chairman at that time, Podos, "Oh, you think so?" he said, and he challenged me. There is this problem that corticosteroids produce in 20% of the normal population glaucoma, increase intraocular pressure. And that has been tested in the rabbit, but the pressure in the rabbit doesn't go up that much unless you give enormous dose that almost kill the rabbit. So what you're telling me is true. You should test drop of corticosteroid, for example, nisolone, to see whether the eye pressure of your cow that transport chloride goes up. So at that time then, I decided that I had to go. I couldn't find cows in Central Park, neither in Buenos Aires, and from that northern province. So I visit my relatives in that northern province, Corrientes. And when they waited for me at the airport, I said, I want to go to the slaughterhouse. How far is the slaughterhouse from the city? Oh, 15 minutes. And then you have a medical school here. Yes, there is a medical school. So I went to the medical school and I introduced myself and I say, I want to do research on cows and maybe sheep. They look at me like, where this guy can. The medical school there was just a very little research, a teaching medical school. And I show my card that I was professor in Mount Sinai, and I was originally from that area of the country. And so they agreed to give me a little laboratory. And then they say, okay, and there is a doctor in pharmacology and ophthalmology that's doing some clinical research. She may be interested. This is Dr. Rosanna Gerometa. And then she was in charge of organizing my cow and sheep research, and she rented a small farm, and we used cows that was going to go to the slaughterhouse later on to test the prednisolone. and 100% of the time, the intraocular pressure of the cow will go up with treatment of prednisolone. But we needed to sacrifice the animal. That was becoming complicated and expensive. So we started doing the same thing with sheep. And the sheep were even better than the cows. The pressure doubled after 1 week of treatment and remained high. And the pressure went down after you stop the treatment with prednisolone, and only on the eye that you put the drops. And that study was recognized as a good one, and I think about 2 years ago received what is called the Rudin Glaucoma Award, which is given to the scientific paper in glaucoma that they consider one of the best production of the year. And also, Dr. Borras from North Carolina knew about this study, and she said, I don't know anything about molecular biology, but she said she will prepare adenovirus with a MMP1, which is a collagenase that can be injected to the eye to see whether the pressure, because people think that glaucoma is an accumulation of collagen in the trabecular meshwork. Trabecular meshwork is a series of complicated channels and tunnels with collagen beams, etc. And there is a continued production or destruction of collagen. And when that balance is upset by genetic reason or by the corticosteroid, you get more collagen that you can get rid of it, and so the exit channel of the eye is decreased and the pressure goes up. So I took 15-hour trip, the adenovirus with the collagenase in dry eyes in a plane to Buenos Aires, and then changed the dry eyes and another hour and a half to Corrientes, and then we injected the virus, and it was very successful. Pressure went down in 24 hours. And
what year was that?
That was about 2004, 2005, something. All this collaboration started in 2002. And first with the cows, and then also somebody in Germany which is a specialist in electron microscopy find out that the cow eyes that have the pressure increase have deposit of collagen, very similar to the human eye with glaucoma. The advantage is that the cows and the sheep, they 100% responded. So it's a perfect model, and thanks to that model, we have a grant from the NEI to continue those studies. But at this point, let me go back a little bit to Laszlo Vito. He continued his work on prostaglandins, and he got together, and remember presenting his papers and nobody believed. He got together with a biochemist in Sweden. He used to work for a company called Pharmacia. And the prostaglandins, even though they reduce the pressure topically, they produce a large irritation of the eye. So people saw no future in that. However, with this biochemist, he was able to modify the prostaglandin into another prostanoid that will have the effect of reducing the pressure without producing the irritation. And he patented that, and he's a millionaire. And also gave some of his patent right to Columbia. And this is the drug that is used to treat glaucoma, more successful. It doesn't open what I told you, trabecular meshwork. There is a parallel pathway with very little influence on eye pressure, But when the trabecular meshwork is clogged, prostaglandin opens this second pathway. And now this drug is produced by the two prominent eye laboratories here, Alcon and Allergan, and I think it's another two. And so one advice for young people is to be persistent. It may take years, but if you have a good idea, keep working on it. And another area of research that I'm involved with, that I also am doing in Argentina, is accommodation. Accommodation has to do with presbyopia. Normally, when you're young, your lens can change sphericity. When it's flat, it's focused for a very long distance, infinite. And then when the muscles that control certain fibers around the lens, there are fibers that pull the lens so it will come flat. Or when the tension is released, it goes back to its normal position of being rounded for short distance, for reading. And there are 20 diopters between in a young person focusing a long distance and short distance. And there is a group of people called the accommodation group that study that phenomena. And what they say was that during that process, the volume of the lens didn't change. In other words, the lens was like a rubber balloon. You can press it and modify the surface, but the volume inside the lens remained constant. I question that theory, and because I was doing work on the lens using osmotic forces, and the capsule of the lens that's around the lens is very permeable. You can change the volume of the lens very easily by putting the lens in hyposmotic or hyperosmotic condition. So why mechanical forces will not change the volume of the lens, but osmotic forces will? So using the big Gauss lens and conserving all the accommodation mechanism, I did this work in Argentina also, because the slaughterhouse was only 15 minutes from the laboratory, and I can get unlimited amount of cow's eye, and we developed a relationship with the veterinary at the slaughterhouse, and I developed a theorem that you can measure volume from two-dimensional photograph if the subject or the object that you mentioned is symmetrical with respect to a center axis, like a tire of a car that, you know, when you have an axle and you turn around, the shape doesn't change. And based on that, I calculated that the volume of the cow lens in the two situations changes about 3%. And I predicted, or we predicted, that the same thing should happen in men. And that was published in American Journal of Physiology, that work. And one of the reviewers said, well, yeah, this is Dr. Candia is using the Pappus theorem. Pappus was a mathematician that developed that theorem, I don't know, in the 15 or 1400. But I didn't know about it, and I sort of developed it independently. And people in the accommodation field still weren't convinced, because 3%, and they couldn't detect it at 3% until about a year ago. A group in England using more sophisticated apparatus, they did a study on young human volunteers, and they asked them to look at infinite and to read something to produce the 20 diopters, and then determine with a much sophisticated method the volume of the lens. And they published that the human lens during accommodation changes about 3%, as predicted by us in the American Journal of Physiology like 4 or 5 years ago. So now they sort of accepted the accommodation group accepted my theory, and I was invited to go and present my work in a couple of weeks in Miami. The other thing, if you have time to listen to me, is the effect of sildenafil on intraocular pressure. Sildenafil is Viagra. Pfizer, in 1999, hired a group of Japanese people to study the effect of Viagra in intraocular pressure. And it's very well known that Viagra produces a problem in color vision, but there was a report that they didn't see any effect on intraocular pressure after taking Viagra. What Viagra does is relaxes the muscles in the precapillary arterioles, and that increases the flow to the capillaries. Since the blood bed increases because dilation of the capillaries, the systemic blood pressure has to go down. They didn't find that either, or I don't remember they reported that part. And now we know that Viagra, medical uses include the treatment of pulmonary hypertension because it dilates the pulmonary capillaries and people can breathe better. So there are a lot of capillaries in the ciliary epithelium, the one that produces the fluid for the intraocular pressure. So I say, why don't we test Viagra in our sheep model? And we find a way to make the sheep to swallow the Viagra, and within 2 hours, the intraocular pressure of the sheep double, and then 3 or 4 hours later disappear. We did the same thing with Cialis, and the effect was lasting like 2 or 3 days. And we decided that we had to do this study in human, and we did also in this because my collaborator, Dr. Jerometa, is an MD, and she was able to get the appropriate permits, etc., and volunteers. And we find out that in human, Viagra increases pressure, not double like in the sheep, but about from a normal of 12 to 16 or 17, depending. So there is an effect of intraocular pressure that agrees with an increase of blood capillary perfusion of the ciliary body. That has been published recently in a good journal. And now the problem is that in the medical literature, the same, or in the ophthalmic literature, the same thing as every book say that the volume of the lens doesn't change during accommodation. They say, and all glaucoma clinicians, they say that sildenafil increase intraocular pressure, they will say no. And I think people who are taking sildenafil for pulmonary hypertension should be checked for eye pressure too. So I think that's what I consider my most important contributions to physiology. It's all we have, even though it's in the eye, it always has a physiology flavor in the thing that I do.
Very good. So getting back to APS and our meeting here, Can you remember your first APS meeting?
Well, I remember very well my first biophysical society meeting. At that time, biophysics have a lot of physiology. As I told you, I moved to Louisville, Kentucky in 1964, and there was a physiology meeting in San Francisco in 1965. So that was the first meeting that I attended that has to do with our work in the physiology of the eye. Probably, I don't remember correctly, but before I moved to New York in 68, I did went to an American physiology meeting that used to be in Atlantic City at that time. And it was in several hotels. And so my first meeting was probably around 1966, 1967. And then I continued to go to the physiology meetings from New York almost every year, starting in 1969. And lately, I did not attend all the meetings, but I think in all this year, maybe I missed, 40 years of meetings, probably missed, I don't know, maybe 6 or 7. How different they are. Like everything is much, much bigger than it was before. It requires the expertise of people who are not scientists. So the organization, the scientific organization is still in the hand of scientists. But the meeting as a whole has become an economical enterprise.
So is that a good thing or a bad thing?
Well, it's happening in every profession. Medical doctors, they lost the control of their profession to the insurance companies. And now they are called even providers. They're not even called doctors anymore. But that's happening. Researchers and doctors are busy doing their work. Administrators are busy having meetings how to administer the scientists. So we have become their subordinate of administrators in general. Maybe I'm exaggerating, but maybe not. Mm-hmm. And a typical thing is that, for example, in the program of this meeting, there was a correction, a letter from one of the managers of this convention center blaming the printer for an error in the program. Remember when computer just appeared, everything is a computer now. Now it's a printer. A printer is handled by people. I mean, you should say, sorry, we make a mistake. Don't blame the printer.
Yeah. So what role has APS played in your career?
A very important role. I think I have 2 scientific homes. I'm a member of the Association for Research in Vision Ophthalmology, and also I've been a long-standing member of the Physiology Society. So being a member of the Physiology Society, attending the meeting of the Physiology Society, interacting with physiologists and publishing helped me in develop my physiology eye research. So I will say, these 2 societies are what have really determined my scientific career.
So you've been very fortunate to have over a 50-year career, very successful, productive career in science, which is...
You start counting since when? Since
68.
Well, so even before that,
yeah, so
in
so
Argentina.
So maybe 60
64,
years.
64, I don't know, okay.
So you're very fortunate in that regard. You've been at this for decades. What advice would you give students that are just starting out in science today?
Well, look at the big picture. Right now, a lot of research that you see is details of particular receptor channels and so on. And when you try to put that together, for example, the lecture was given this morning, the Dabson lecture. You see the enormity of all the interaction, what they call system biology now. Somebody has to have the brain to put the puzzle together. It's important to know the detail. It's important to find out how things work on a particular case, but I think don't forget that all this together forms an organ, and it forms eventually the physiology of what you want to study. And so we need both. And I think some people are good at looking specific things, and other people are better in putting all the pieces of the puzzle together. So it depends on your inclination, and I think both things are important and necessary. And again, be persistent like Laszlo Vito was.